Hello and welcome to Ask the Expert. I'm your host, Robin Berardini, live in studio with Dr. Walter Tom. Welcome, Dr. Tom. He is the medical director for the Aesthetic Laser and Vein Centers of the North Bay, First Street in Napa, and Stony Point Road in Santa Rosa.
Thank you, Robin.
I'm glad you're back. Thanks for joining us. I know you're super busy. New things going on. I know, in fact, I've looked online when I'm doing things online, just, kind of having fun at home and stuff. There you are, blogging away.
Away.
It's late. And do you ever stop?
No, it doesn't seem like you're doing that, putting a few things on Facebook. It's the modern world we live in, right? We're up late on our computers.
And the latest thing I've seen on there on your website at laserandvein.com, very comprehensive, beautiful website, by the way. We encourage you to check that out 24/7. Can fat save your life?
Absolutely.
Okay.
Yes. I'm glad it caught your attention, because when you blog, you have to think, okay, how am I going to grab the attention of the readers or the web surfers? And so I thought, can fat save your life? And absolutely it can.
Oh, come on.
Absolutely.
How so?
As you know, we're always looking at the latest technology,
yes,
trying to figure out what makes sense, what do we think is going to be here for the long term. And our technology is developing at such a rapid rate that, it's amazing. It's hard to keep up with all of this.
I would imagine.
Right. But something that we would have thought in the 70s, 80s, and even the 90s, thinking, oh, come on, this can't be true, is actually happening now. We are looking at fat, and in short summary, taking your fat, finding your own stem cells out of your fat, and storing them so that someday, should you develop a medical problem that can be altered or cured by using your stem cells, you'll have your stem cells there to potentially save your life.
So it's so much information to take in, really.
Right.
I mean, it's just incomprehensible, like you said, in today's day and age. I would think in the last 100 years, as we look over the decade, and these strides that we've made decade to decade, will kind of surpass anything in history as far as our advances.
We will. I mean, back in, as we look at medicine, we look at our longevity. Probably some of the greatest advances have been antibiotics, vaccinations, and an anesthesia for us to be able to do, obviously, very intricate surgeries.
Sure.
So those have been advances that I've just sort of seen or studied over the years. We are all now, we're on our smartphones, we're on the internet and all that, and it really wasn't there in 1990.
No,
it wasn't there. I mean, it really started in the beginning of the 90s, and then, of course, has blossomed to where we can't even imagine living without our computers and the internet in particular.
Absolutely.
So people have been looking at stem cells for a while.
Yeah, you just hear of them, but really kind of at a different level. In my thinking, stem cells were something that scientists did in the research labs.
Correct. And that's where it really still needs to be in terms of the research, because what I'm going to suggest or even recommend is still predicated on science moving forward.
Okay.
But what are stem cells? Let's start off with that. What are stem cells? Okay, so stem cells basically are very early cells in our body. They're cells that can differentiate, if you will, or they're immature cells that can mature into a certain type of cell type. Now, what do I mean by that? So we take this immature cell, and we may be able to culture it and have it grow into muscle cells, or into cartilage cells, or maybe into heart cells, right, or into blood product type cells, or skin cells. So those are the kind of things that stem cells potentially can do.
So you can harvest them, and they can grow into any of those things that you've just mentioned?
That's correct.
Interesting.
We originally looked at stem cells coming from our bone marrow, and so that was where most of the research was looking at. And then they found that it's interesting how beauty this time may lead to health versus health leading to beauty, is that by taking the fat cells a lot through liposuction techniques, is that we have actually more stem cells sitting in our fat tissue than we do in our bone marrow. And it was really surprising to me when I first heard this. But stem cells actually then can mature, if you will, into different types of tissues. And as you know, I'm extremely passionate about taking fat from one part of the body with liposuction techniques under local and doing, for instance, facial fat grafting. And again, go to laserandvein.com and you'll see some great before and after photos. I think it's a wonderful, natural look.
Sure.
And one of the things that we noticed
and
was...
it rejuvenates itself. I mean, just unlike fillers.
Right. It has its longevity.
Yes.
We tell patients it can last 3 to 8 years.
But
one thing that we notice, and maybe what you're referring to in the rejuvenation part, Robin, is that the skin of these patients who have had fat injected into the face looks so much more youthful. It just looks healthier. I mean, it's amazing.
It is.
And so part of that may have been, in part, not just putting more volume in the face, but the fact that we are transplanting stem cells along with the fat that is now taking residence in that area and is building back up the tissue that is there, the target tissue. So in this instance, your facial skin. So very interesting. It is amazing. And, clearly we can see that the skin of our patients when we inject fat in that area looks better, looks healthier. And you talk to most surgeons who do this kind of procedure and they would all agree.
I wouldn't think that would be a side effect, but it's a nice one.
It's a nice side effect. Yes, that's one of those very nice side effects. So what we can do is we can take the fat from a patient under local anesthesia and we can send it off to, in this case, I'm working with a company called American CryoStem, C-R-Y-O, capital S-T-E-M, and they're based back east, although they're planning on expanding out onto the West Coast for some of their preservation facilities. But basically what we would do is we would harvest the stem cells from your fat. Okay, we harvest the fat in our office.
You do?
Right. And then this is an in-office procedure, exactly. And that's what's so great about this. So you come on in and we harvest the fat through, basically all under local anesthesia, a little local anesthesia, we make a tiny little needle puncture, if you will, and we take a very tiny little tube that's blunt and we pass it back and forth after injecting the fat area with local anesthesia, and we basically are suctioning some fat out. Okay.
How much do you need?
We need about 60 cc's. So what is our 60 ml? So for those who don't know the metric system, let's help you with that.
Thank you.
So 15 ml or 15 cc's is what's in a tablespoon when you bake.
All right.
So
that makes sense to me.
All right. So now that makes sense. So a tablespoon of butter, is 15 cc's. So we're talking about 4 tablespoons of fat. So basically that's what we're recovering.
All right.
And then we have special sterile packaging that we send to American CryoStem.
Now, is it just like perhaps withdrawing blood?
Well, no, it's a little bit more than just withdrawing blood because we're actually doing it, not much, but again, with, under a surgeon's direction, I'm doing the procedure.
Right.
It will be minimally invasive. It should have basically no downtime with this. But what we would do is harvest that fat, we package it, we send it off to American CryoStem, and they do all the tough work. Okay, so they're going to be pulling out the stem cells from the fat, concentrating it, and then they cryopreserve it, and that's key. So then it's kept at their preservation or their cryopreservation facility on the East Coast, and it's kept there, and it can be kept there indefinitely. Now,
I'm a bit skeptical about that because this has been the issue. Has it been to keep it and keep them fresh and viable?
Right. And so they have, and you know what I would do is I'd recommend, and we're actually about to create a link because this is pretty groundbreaking news, okay? We're just creating a link with our website. We just actually sent an email off to our webmaster on this to American CryoStem. So go on the internet and besides looking at our laserandvein.com for the blog that I wrote on it, go ahead and look up American CryoStem, and they have a very nice explanation of the process, how they do it, what they do, and answering sort of those most frequently asked questions, the FAQs. And I think you can get a lot of information from there. But what they do is, with their preservation system, is they preserve it. Now, so you have your stem cells sitting there, in the CryoStem system. And so what they would then do is, hopefully you'll never get ill or have any major issues. But should you come down with a problem that can be helped with the use of stem cells, now you can contact American CryoStem, which can then supply the physician or the university or the company that needs your stem cells, and to be able to utilize those stem cells to then create either something that's going to help you or maybe even potentially cure you of whatever that problem may be. But again, that's
it's hard to really grasp. That's up and
it's
coming.
really great. It's futuristic, but I think, and again, when you do this, you have to understand that you're kind of taking on an insurance policy, if you will.
It sounds like that. Like we buy insurance for our homes, our cars, life.
Right, and so you can look at it as a sort of a life insurance policy, but it's but I can't tell you today, at the end of 2011, I can't tell you that it's going to cure this, this, and this. What we have to do is we kind of have to wait as science progresses to see where stem cells will be utilized. We already see that stem cells are being used to create cartilage tissue. So certainly for those of us with creaky knees and arthritis and breakdown of our cartilage and our meniscus, that it may have a role there. I do know of a company that wanted me to harvest fat for some of their research that they're doing in terms of creating heart muscle. So with those people who've had a heart attack, this may be actually a great technique where you'll be able to use your younger stem cells that have been preserved, healthier stem cells, and be able to create heart tissue for you and may be able to help you along the way. And again, certainly I'm not promising that this is the case, but that is certainly what I see in the future.
Possibilities seem endless, Dr. Tom.
They really are. I think it's very exciting.
You're like, your body language changes.
Right. This
completely.
This is really a great little thing. And as you know, I was a general vascular transplant surgeon for 20 plus years. So I was I always joke, I used to save lives. Now I'm a glorified, hairdresser. I'm a foo-foo doctor, I'm dealing with beauty. But this is so exciting because this is something that we can actually potentially help people from a medical standpoint with a technique that we use in cosmetic surgery all the time, and that's with simple liposuction techniques.
Can fat save your life? It seems like we can do something like that. And we're talking live and directly with you and Dr. Walter Tom on News Talk 1350 KSRO. Back in a moment. News Talk 1350 KSRO. Thank you for joining Ask the Expert. I'm your host, Robin Berardini, live in studio with Dr. Walter Tom. Dr. Tom is the medical director for the Aesthetic Laser and Vein Centers of the North Bay, First Street in Napa, and Stony Point Road in Santa Rosa. Welcome back.
Thank you, Robin.
We're talking about can fat save your life and the benefit of stem cells and the research that's going on around that. And indeed, as you say, fat can save your life. Now, we're talking about harvesting your stem cells for future benefits. How can we do that, and why is it important?
So if somebody is interested in this technique, so again, I'd recommend going to our website, read the blog at laserandvein.com, go and look up American CryoStem, CryoStem on the internet, and they're a very nice website, and you can get more information. But basically,
that's the housing facility.
That is correct. Okay. They're the processing and housing facility. We're the harvesters. Okay, we're the harvesters, and then we send it off. Okay, we're the farmers, and we harvest it for you, and then we send it off for processing to the factory. Exactly. And you can always call our office at 707-542-8346. So 542-8346 or 542-VEIN, as we always say. But you can give us a call, and the consultations are always complimentary.
Great.
But in short summary, what we do is you come in, you have a consultation, make sure there are no issues. We then explain the procedure, which probably will take us about half an hour to do, about 30 minutes. We will set up more time for that. But if all we're doing is just harvesting the fat, what we would then do is all under local anesthesia in a sterile technique. It's very important. And again, with my background as a surgeon, we do everything sterilely anyways. Perfect. But we would then freeze up the skin with a little lidocaine, or for some people, they may remember the term Novocaine. So we just basically freeze up the little skin, little skin area.
Where do you do it? Does it depend on the patient?
Most popular, it depends on the patient and where they maybe have the fat, with the most fat. But typically it's going to be off the hip area, maybe the muffin top area, the lower abdomen, and the outer thigh.
All these different places?
All those different areas you can choose are possibilities. Exactly.
I got you. And you again, just do one incision or poke?
One little poke.
Okay.
And for those
it's not going everywhere.
Right, no, it's about a 3 millimeter, if you want to know how big it is, a 3 millimeter in diameter little hole. Freeze it up and it'll heal up just fine.
Okay.
And so what we do after we inject the local anesthesia, very much like you go to see the dentist, and we just go very slow to try to make it painless if we can. We then take this cannula that we call a cannula. It looks like a long needle, but it's a cannula because it's blunt, and it has holes on the sides, and we go in, and with a little bit of suction, it has little perforations at the end, exactly.
Right. Okay.
And we basically we move it back and forth, and we're suctioning fat in through the cannula into the syringe where we're collecting it. Okay. And after we collect our, as we said, 4 tablespoons, or about 60 cc's, or 4 tablespoons of fat, we then process it sterilely with the system through American CryoStem, and then of course it is then sent off to the American CryoStem on the East Coast. At that point, they then go through their processing of separating out the stem cells from the regular fat cells, if you will. And then they have their cryopreservation kind of materials that they will add, and then they're, if you will, in a deep freeze, and they cryopreserve the fat, the stem cells. You now have your purified stem cells sitting there waiting for you to be used at somewhere time in the future.
Okay, and again, just if people are just joining us, Dr. Tom, why do we want to do this? Why do we want to keep our stem cells? Right. What are the benefits?
Right. It's, again, we're looking at it a little bit like a life insurance policy, but we're not sure if where will science be. Okay. Hopefully, we're all going to live decades longer, right? Yes. Everybody who's listening.
Yes. Well, everybody's getting healthier these days, it seems.
It is.
We have opportunities to live longer, healthier lives.
Yes.
But this is just kind of an insurance.
And this may be insurance. And may not just be longevity of life. This may actually be in terms of quality of life. So,
Even
of
better.
course, the first thing you hear is well, maybe I can use this if I have a heart attack from my heart. Well, obviously, that's quality of life. Yes. But it might be for people who have joint problems. We already know that they're using stem cells in various stimulants for stem cells in the joints and helping people to feel better, to walk better, to move better.
That.
Yes, already. That's with another item called platelet-rich plasma. So there's a lot of, if you will, exploding technology and developments that are occurring. We're going to have to wait. Time will only tell which ones will be the ones that will have the proven track record, but that your stem cells are sitting there waiting. Hopefully you'll never need to use them,
right?
But if you do, they're there for you to be utilized. So then American CryoStem would send your stem cells to the facility that would be culturing them and processing them to grow into whatever tissue that is needed for you.
Okay, so there's a lot of boomers. There's a lot of us kind of aging.
Right.
So this could help us with this arthritic things. Or let's say somebody had an injury and earlier, and then later on,
skin, for instance, if you lost skin due to trauma or burns, maybe that might be helpful in that kind of situation. And again, I'm just listing the potential possibilities. So you can, not only are you looking at skin, I'm not talking cosmetics now, I'm talking about medical health issues. So we're talking about joints. We looked at the heart in terms of regenerating heart muscle. We're also looking maybe at various neurologic problems like Parkinson's disease. We know that has to do with a deficiency in one part of the brain. So it may be that we can stimulate these stem cells. Remember, these are your own stem cells. These are your body. These are adult stem cells, These are not embryonic stem cells. They're not taking from somebody else, so forth. These are your stem cells. And you're just basically banking them and hoping that technology will develop something that will help you in the future. So if you develop a neurologic problem, if science has progressed to the point they can take your stem cells, help to develop and to repopulate a certain type of nervous tissue, that might be something that could help to make your life better.
Alzheimer's too, perhaps?
I don't know that. I don't know. that.
Well, it's a neurological thing. Dementia, it's like, oh, goodness.
So we have to kind of look and see what the future will hold in that. But certainly the stem cells has that potential. And the nice thing is it's a simple procedure. You come in.
And we can do
local
it locally
anesthesia.
at aestheticlaserandvein.com in your office?
We do it right in the office, Aesthetic Laser and Vein. No, what we do, we happen to have a little surgery center right in our office itself. And so, again, we'll do it completely sterile, even though procedure-wise it might take us about half an hour to do. Okay, probably set it up for an hour or so. Yeah. And it's just a sort of a standalone treatment. You come in and have that done. You could also, if you wanted to, now this is different because we mentioned for just harvesting, we're not talking about any type of cosmetic manipulation, if you will, in terms of contouring the body. But if somebody were saying, I think I'm going to have that laser lipo Dr. Tom does, and I want to work on my abdomen and my muffin top, or I want to take care of my saddlebags, but I heard about this stem cells that he's doing. Could he also harvest some fat at that time and send it off?
Can we?
And the answer is yes, absolutely. That can be done.
So we can do both things kind of 2 for 1?
Yeah, in a way. There are charges, obviously, to do this, processing charges. And what American CryoStem, I believe right now it's around $1,900. Maybe it's $1,990. It's around $1,900.
That's the fee for them to
that's for
harvest,
American
process.
CryoStem. That's the fee for them to process it and store it for 1 year.
Oh, okay.
And then I think you're looking at maybe a couple $100 a year annually
All right.
to keep it in storage. If you just came in and said, I just want you to harvest some stem cells for me, some fat for stem cells, to send off to American CryoStem, it's $1,000. Okay. If you are adding it to our lipo cosmetic procedures, like smart lipo procedure, then we charge a $500 professional fee for the process.
I like that, Dr. Tom.
So you can do that. Now, you still have to pay American CryoStem, so make sure that that's clear.
Right.
But that's an advantage because it's the setup. Part of it is so we're set up to do your cosmetic procedure, so we don't have to charge that much more. If you're just coming in to have it harvested to send off to American CryoStem, we still have to do the setup.
I got you. That makes sense.
That's the differential in the costs.
Listening to Dr. Walter Tom, can fat save our life? I think indeed it can. More of Dr. Tom right after this. News Talk 1350 KSRO. Welcome back to Ask the Expert. I'm your host, Robin Berardini, live in studio with Dr. Walter Tom, the medical director for the Aesthetic Laser and Vein Centers of the North Bay. Can fat save our life? Kind of a moving forward thought here, isn't it, with these stem cells that we're talking about?
Yes, very exciting.
Very exciting. And talking about harvesting these cells and kind of processing them and preserving them for future use in the event that something may happen to us. We haven't really talked about the big C word. Right. Cancer. I know that you have a background with helping many breast cancer patients.
Right. As a general surgeon, for over 20 years, a third of my practice revolved around breast diagnosis, cancer diagnosis, and the treatment of breast cancer patients. And we do know that the unfortunate women who developed advanced breast cancer, that sometimes they would undergo some significant chemotherapy in order that would knock out their immune system, and they would need a bone marrow transplant, if you will. Right. My hope, okay, and again, I'm saying maybe or may. I'm always stressing the MAY word because I can't guarantee any of this. We have to wait for science to catch up. Okay. My hope is that if people do store their stem cells, that should they develop a cancer, that if they require this more aggressive chemotherapy knocking down their immune system, is that my hope is that the stem cells may be used to repopulate your immune system and help you to be able to undergo these treatments and to help to prolong your life. And so that's kind of where,
exciting.
That was one of the very first things that I thought about, but that's because of my history. But again, it may be helping somebody with a neurologic problem that's due to a lack of certain types of nerve tissues in the brain. Again, I don't know of anything work with the dementia part that you'd mentioned, but maybe somewhere down the road that might occur. Sure. We talked about things from trauma, maybe regenerating skin, cartilage, the trauma of everyday living with, as you had mentioned during our break, Robin, with injuries in our knees and cartilage and shoulders, maybe being able to use that. And why donate your stem cells now? Why do it now? It's because your stem cells are healthy. Your body is healthy. You want to do it when you're healthy. Okay. You grab those stem cells where they're healthy. There's no diseases going on right now. And again, they're cryopreserved. I know that sounds so futuristic.
It does. I know. I think of like, bubbling dry ice, in the lab or something.
But there you go. And you have these stem cells that hopefully can be used sometime in the future as science progresses. So, and especially for an outpatient, simple procedure, spend about an hour in the office, okay, having this done. Or as an add-on to a cosmetic procedure, undergoing some type of liposculpture or smart lipo or laser lipo that we do in the office.
So I can put that on my calendar.
So you could put that down.
Smart lipo with Dr. Tom.
And then you can justify it if you feel like, oh, I'm being so vain doing this. You can say, but I'm having them harvest my stem cells.
I'm doing it for the benefit of the future.
That's right.
My
I'm
life
doing for my
policy.
health benefit as well. That's right.
I like the idea, Dr. Tom. So can we call and get more information at your office?
Absolutely. Again, 707-542-8346 or 542-VEIN. We'll have information on that. As I just mentioned, it should be hopefully up on our website within the next couple of weeks. Our webmaster's pretty busy guy too, so we're going to do that. But again, go on to the internet and look on American CryoStem, and we're going to be the first physician who's going to be offering this in the Northern California area.
Congratulations.
Thank you.
LaserandVein.com with Dr. Walter Tom live in studio. Back again next Thursday right here on News Talk 1350 KSRO. Thank you, Dr. Tom.
Thank you.
We'll see you next week.